Gestation YouTube series, Week 10. Birth options and where are you going to birth your baby?
Hi, welcome to About Birth. I'm Jules.
And I'm Lael.
And you're 10 weeks pregnant. So at this stage, your uterus is the size of a grapefruit.
And your baby is the size of a date.
What we recommend at this time is you start to consider birth options, so where you're actually going to be having your baby. What usually happens at this time is that you go to a GP to have your pregnancy confirmed, and then you get referred to a particular model of care. Sometimes that model of care isn't necessarily aligned with the type of birth that you want, so we'll talk about that more in a minute. What we do recommend is that you do some research on who is going to be the best health provider to support you through your pregnancy and through your birth. What we say is that most couples or people actually spend more time doing research on buying a new car than they do on finding a care provider for their pregnancy and birth.
Yeah, we've found that in a lot of our workshops, couples come to us around 28, 30 weeks gestation, and by the time they're locked into a certain model of care, and after learning what birth is all about, they realise they're probably in the wrong model of care for the birth they want. So it is worth doing your research early to find out what your options are. So speaking of your options, in Australia we have many different options available to you as to where you can have your baby. One option is to have a home birth, a planned home birth with independent midwives. And you have an independent midwife who cares for you throughout your whole pregnancy. She's there for the birth and postnatally. This is a very good option for women that are low risk and also who are wanting a natural birth. We also then have the option of a birth centre, and most birth centres are attached to a hospital, usually a larger hospital. And again, you'll be cared for by midwives in your pregnancy. Usually there's a team of midwives that care for you, and usually one of the midwives that is known to you is usually there for your birth and postnatal care. We then also have the public system, which is a public hospital where you are cared for again by midwives and doctors. Usually you don't know who those midwives and doctors are, depends when you go for your checkup, and usually at the birth it's whoever's on shift at that time. This is also a good option for women if you are high risk to be in our public system, because we have very, very excellent medical care in Australia for women that do need it. Then your other option is to go private and have a private obstetrician at a private hospital. This is where there is often some out-of-pocket for the couple, to pay for it, and usually couples that have private health cover usually go down this track. Private obstetricians are excellent for women that are high risk, and with a private obstetrician you get to choose who your obstetrician is and what I guess you're wanting for that birth.
To learn more, visit aboutbirth.com.au.